Hello, I'm Jason Howland. Welcome to Speaking of Health, a place to help you learn how to live a longer and healthier life. Arthritis is one of the most common health problems in the U.S. Millions of Americans have some form of arthritis that leads to pain, stiffness, and loss of motion. Many of those folks are over the age of 65, but people of all ages, including children, can be affected by arthritis. Our guest today is Becky Ness. She is a physician assistant who practices in the specialty of internal medicine at Mayo Clinic Health System. Becky, thanks for joining us today.
You're welcome. Thanks for inviting me.
Well, arthritis is our topic today, as I said. Let's begin by defining what exactly is arthritis.
Okay. Well, arthritis is an inflammation within the joint. It can cause pain, stiffness, swelling at times, typically worsens with age. And the two main types of arthritis we'll talk about are osteoarthritis, secondary to normal wear and tear, and then rheumatoid arthritis, which is an autoimmune condition.
So what are the common symptoms of arthritis?
Most commonly, people notice pain or stiffness. There can be some swelling, particularly with rheumatoid arthritis or an infective type of arthritis. There can be redness. And the biggest issue is a decrease in the range of motion.
When you talk about pain for arthritis, often is it a sharp pain or is it like a dull, long-lasting pain?
It kind of depends. People can experience a kind of a multitude of types of pains. Most of the time we hear that it's stiff, achy, kind of just sore all around. There can be sometimes when there's a sharp significant pain. Osteoarthritis pain tends to be worse until we start moving and get the joint moving, and then it lessens to some degree and sometimes completely goes away. With rheumatoid arthritis, it can be incredibly debilitating and last without relief with motion.
You just talked about the two main types of arthritis. Let's talk first about a little bit more about osteoarthritis. How common is osteoarthritis and what joints does it often affect?
Well, osteoarthritis is our most common type of arthritis, typically affecting older individuals. However, there are younger people who can suffer it, especially if they've had recurrent injuries or trauma to a joint. With osteoarthritis, the synovial joint, kind of the area where the cartilage covers the bone, gradually wears away after repetitive use and kind of constant contact with each other. This results in the bones kind of rubbing together. And at that area, we can get new bone formation called osteophytes, which are seen on X-ray. Because of those bones rubbing together, it causes inflammation and swelling in the area, which causes pain. Most common joints affected can be the smaller joints in the hand, to some extent the wrist, but really the one we hear the most about is in the hips and the knees, and to some extent the low back.
And is that because those are more weight-bearing joints, so they bear a lot of the body's brunt?
Absolutely. They carry us in all settings except for when we're lying down. Even when we're sitting, there's some degree of pressure, particularly in the low back and the hip.
So does the cartilage sort of act like a tire on a car, and then over time it's wearing down and that's what osteoarthritis really is, or is it different than that?
Kind of. A different example that I give to my patients is if you have a chicken bone and the ends are kind of nice and shiny, and then the dog gnaws on them or you're scraping the meat off of the bone, and you can kind of see how it gets frayed and irritated and dull instead of that nice, smooth, shiny. That's kind of what happens.
So let's talk about rheumatoid arthritis. So that is different from osteoarthritis.
It is. Rheumatoid arthritis is what's considered an autoimmune condition, meaning the body's immune system is starting to attack itself. And in rheumatoid arthritis, it affects the lining of the joint capsule. That's a tough membrane that kind of encloses the joint. And as the body's immune system attacks that, it causes inflammation and swelling within that joint, and over time, destruction of the joint itself.
So why exactly is the body's immune system attacking its own joints?
We don't know 100% why rheumatoid arthritis. There's a number of theories out there on what can cause it. It is a hereditary condition. So you have a greater risk of being female, and if there's someone in your immediate family or like a grandparent or an aunt or an uncle who has rheumatoid arthritis.
So because it affects the joints, it sounds like arthritis, whether it's osteoarthritis, rheumatoid arthritis, or other, that it really can cause a lot of complications in people's lives, especially with movement.
It can. As arthritis progresses and it becomes more severe, it can really decrease the quality of life, make it difficult to brush your hair, do buttons, clasps, things that require small movements, but specific movements. It also makes it difficult to change position, getting up, walking, climbing stairs, getting in and out of a vehicle.
So who's more at risk for getting arthritis? Are there certain people that just are more at risk for getting it?
Well, like I said before, particularly with rheumatoid arthritis, but to some extent with osteoarthritis, the family history, people who tend to be overweight can be more at risk. If there has been a previous injury or trauma to the joint, can increase the risk of arthritis developing, and age is a big one.
And when you say family history, are you talking immediate family, or can it skip a generation, or is it all random? It all depends.
It kind of depends on the arthritis in the family. There are families where it's generation after generation after generation, and then there's others where it's kind of sporadic and it'll skip 1 or 2 generations, but it's still there.
And when you say previous injury to the joint, so would that be someone like, for example, has a sports injury to their knee or something similar to that, or a different kind of injury?
Runners who have just kind of a constant impact type injury, lacrosse players, that type of thing. And then also people, professions like people, carpet layers, electricians, plumbers who spend a lot of time bent over, small conditions, on their knees, hard floors. People who work in warehouses who spend a lot of time on cement floors that don't have a lot of cushion can cause increased wear and tear to those joints.
So when someone has been diagnosed with arthritis, how do you as their provider, how do you help them treat it?
Well, the first thing that we focus on are things that they can do to help slow down the progression of the disease and to some extent reverse it, such as weight loss, regular physical activity. There are over-the-counter medications that can be used. Acetaminophen or Tylenol is probably the most recommended. There are some anti-inflammatory medications like ibuprofen, Advil, Excedrin, Aleve, but those non-steroidal anti-inflammatory medications can interact with a lot of medications and aren't really recommended with other health conditions, so we recommend that you follow up with your healthcare provider before you would take any of those. Physical activity to help keep the joint lubricated and moving, like walking, swimming, bike riding. Application of heat, like a hot wet towel or a hot pack, can be really helpful. And there's topical medications available over the counter like Aspercreme, Mioflex, Bengay that have some anti-inflammatory component to it. Biofreeze is another one that's available without a prescription. And then there's prescription anti-inflammatories like diclofenac that can be helpful as well.
And all of those medications, should you talk to your provider before you start taking them?
I would recommend it because depending on the type of arthritis, the severity, and the joint involved, there's going to be different recommendations on how often to use them or apply them.
So what about physical therapy? Can physical therapy help?
It can. Physical therapy can be really beneficial. It can act as kind of a catalyst to get people moving and active again because you kind of have a coach alongside you helping you with what activities to do, how to do them, how often to do them. 1 or 2 sessions with a physical therapist to show you how to do an activity safely to prevent further harm can be beneficial as well.
Because I would imagine that's often the problem with folks with arthritis is that they make do by doing things that are actually probably causing more harm as far as movement goes with their body, and physical therapy can probably help them with that, right?
They can, yep, because what the physical therapist will do is the proper technique to do an exercise. It'll also give stretching and strengthening activities for the muscles above and below the joint to help with stability and to lessen the impact on that joint.
What about surgery? Are there surgical procedures that can help alleviate pain and symptoms with arthritis?
There are. In-office procedures, they can do a corticosteroid injection into the knee or the joint affected to kind of decrease the inflammation. But when those modalities fail or the pain becomes too great, we'll do a total joint replacement, most commonly in the hips and the knees. Not too many of the other joints at this point have been corrected surgically in that regard.
And when it comes to joint replacement surgery like that, does that eliminate the arthritis completely?
It can in very many people. The biggest thing with joint replacement surgery is you have to do the physical therapy, you have to stay active, you have to abide by the restrictions of how to move, how not to move with that joint, because you can do damage to an artificial joint as well, and that a lot of times causes more pain than it fixed.
What about alternative medicine, things like acupuncture, yoga, that kind of thing? Do those help?
They can actually be very beneficial. Yoga and Tai Chi I recommend to almost all of my patients, whether they have arthritis or not, but particularly to those with arthritis, because again, it's minimal impact, gradual range of motion to help with balance, stability, and strength. And then acupuncture is up and coming. More insurance companies are covering the procedure, but it can be very beneficial for the pain and the inflammation involved in arthritis as well.
All right, so what advice do you have for people who want to, they don't have arthritis, but they want to prevent it from occurring down the road, or for folks that already do have arthritis, maybe it's not so severe, but they want to prevent it from becoming severe?
Right. Probably the biggest things is maintain a healthy weight. If you're overweight, work with your healthcare provider, dietitian, healthcare team in losing the weight, maintaining a healthy weight that decreases the stress and the impact on those weight-bearing joints like the hips and knees. Exercise is very, very important. It's kind of a catch-22. It's stiff, I'm sore, I don't want to move, but once you get up and moving and get that joint moving, the pain should lessen, and maintaining your physical activity will actually help slow the progression of arthritis. Things like walking, biking, swimming, water aerobics, water walking, those types of things. They're non-weight bearing because of the water's buoyancy takes the heaviness off of the joint and can be really beneficial.
So you don't need to run a marathon or lift bench press 250 pounds?
No, none of the, don't be a weekend warrior. Don't sit on the couch or sit in your office all week and then go out and try and do, an Ironman on the weekend or something without training, but just regular physical activity. If you have a dog, walk it. Dogs love walks. If you have young children or grandchildren, play with them, go to the park, go on bike rides, go on walks in the woods. Those types of things are going to really help keep you mobile, keep you limber, and keep you moving.
So Becky, here in the Midwest, we have very cold, harsh winters, and you often hear folks that say, I know a storm's coming because my knee is acting up. So can arthritis be affected by our environment? It
can. As I kind of alluded to earlier, warmth is very beneficial. So usually in the warm, humid summers, we don't tend to have too much of a problem. As it gets colder, as the barometric pressure changes, that can actually affect the inflammatory response in the body, which is why people say, oh, yep, we're going to get a storm. I can feel it in my knee. But the cold can do that too, because it affects blood flow. It affects the stiffness of the muscles and the joints. So it's not uncommon when it's cold, when it's damp, when it's raining, to have a little bit of a flare, or to feel a flare in the arthritis symptoms.
And also, when folks do have arthritis, do they often, are there certain times of the day that they may feel those symptoms more often? Like, for example, right when they get up out of bed, or perhaps if they've, been exerting themselves a lot, or does it just pop up whenever?
Well, with rheumatoid arthritis, it can kind of be a constant thing because it's actual destruction of the joint line because of the autoimmune process. In osteoarthritis, people tend to have symptoms upon waking up in the morning because they've been immobile in one position all night long, or if they've been sitting, playing cards, watching a television program, sitting at their desk for a long time at work, and those first couple of steps when they get up and try and get to moving around, or if they've kind of been a couch potato all winter and hermited inside like most of us have a tendency to do, and then when it gets nicer out and you want to go for a walk and do things, you're going to be a little bit more stiff and sore, but usually within the first couple of minutes of movement, the pain with osteoarthritis tends to lessen.
And there is no cure for arthritis, correct?
No, there is not.
So it's basically trying to prevent arthritis from occurring, or lessening the symptoms, or helping alleviate the symptoms.
Correct.
Right.
The biggest thing that we really try and focus on is prevention.
So Becky, you mentioned heat as being a treatment for arthritis symptoms, things like a heating pad or a heat pack. Can that be overdone? Can you give your body your joints too much heat?
You can, actually, yep. I know they sell over-the-counter thermacare wraps and those types of things. I'm really cautious of those. My personal preference is a hot, wet towel because it's going to gradually cool with exposure to the ambient air temperature. Really what the goal with heat therapy is no more than 10 to 15 minutes in any given application. Too much heat, usually 15 to 20 minutes or greater, is actually going to cause an inflammatory response, which is going to be counterintuitive to what we're trying to do.
All right. Well, unfortunately, we are all out of time, but I'd like to thank our guest today, Becky Ness, Physician Assistant from Mayo Clinic Health System, for joining us today on Speaking of Health, a great topic. Thank you very much.
Thank you for having me.
Have a great day, everyone, and be healthy.